Hi, my name's Melody. I'm a nurse here at Mason General Hospital, and we are going to be doing a little skip for you today about teaching patients starting at admission and going on through their stay and then at their discharge. It's important that they start education on admission because there's too much to learn when they're in a hurry to go home. So we're going to give them this packet, and we are going to improve and make our education system more robust to our patients, and we're going to include Teach Back today. Good morning, Lacey.
Good morning.
How are you feeling?
I'm okay.
Yeah, your heart rate is still 120, your blood pressure is still high. Have you ever had this problem before?
Never.
Nope?
No.
Okay. Well, I know they got you all settled in and we got you admitted. Here is a packet that has some information about tachycardia, which is high heart rate and high blood pressure, and also some information about the medication that doctor has prescribed for you. So I've got that medication right now. We're going to check your vital signs again in about an hour. So let me go ahead and scan your armband. Tell me your name and birthday.
Lacey, 8976.
Okay, awesome. And I'm going to scan the pill here, and this is called metoprolol. And metoprolol, what that's for is it lowers your heart rate and lowers your blood pressure. It's called a beta blocker. I'm going to be checking your vital signs. Do you know anything about metoprolol at all?
No.
Okay. So we're going to give that to you. When you've had high blood pressure and we drop it, you can feel a little bit dizzy, a little bit lightheaded. So, always use the call light. We don't want you getting up on your own with these new medications. And we'll just see how that works for you, okay? All right, so go ahead and take that. And if you get a chance, when you feel better, read that pamphlet, okay?
Okay.
And I will be here to answer any of your questions, and I'll be talking to you throughout your stay so that you understand your meds when you go home.
Okay.
Okay.
Thank you.
Hi, Lacey. How you doing today?
I'm better.
It's good to see you up in your chair. Good.
Thank you.
And your vital signs look better. Your heart rate's 88. Your blood
Good.
pressure's come down nicely. Have you been feeling dizzy or anything?
No.
Good.
No, I feel
Okay.
fine.
Awesome. That's great. So this medication is working for you. Did you get a chance to read anything about your condition
I did.
and the
I did read a
medication?
little bit. Yeah.
Awesome. Can you tell me what you remember about metoprolol?
It's to control my heart rate and my blood pressure.
Great. Okay, good. Okay, so one of the things that I want to teach you while you're here is how to take your heart rate, because when you're on meds to make your heart rate lower, we don't want it to go too low. Okay? So have you ever done that before?
No.
Have you? Okay, so just feel your radial pulse here with your fingers. Can you feel that?
Yeah.
Good. Okay, so you can time it for 15 seconds times 4, or sometimes I do it for 6 and add a 0. Or you could count for a whole minute if you really want to. Can you feel that?
I can.
Okay. And what are you getting?
$20?
Okay. For how many seconds?
15.
Okay, so times 4, it was a minute, so 80. Good. Good. Excellent. So what I want you to do is take your heart rate every day. And do you have a blood pressure kit at home?
I do.
Okay.
I had one of those automatic.
Oh, awesome. Okay, so it would be really good for you to take your heart rate and your blood pressure every day, write the numbers down on a calendar or something, or a piece of paper, because when you go to your doctor, they're going to want to see that. But it's important that you don't take metoprolol if your heart rate is under 60, because we don't want to bottom you out and have you pass out because your heart rate's too low, okay? So that's why I wanted to show you that. Do you have any questions for me at all?
So if my heart rate's less than 60, I don't take it that day.
Right.
And then
right.
just
And check
recheck
your
the
blood
next-
pressure. If your blood pressure's under 100, I would call your provider, because, yeah, you just want to make sure that you're not lowering it too much to the point where you're dizzy and passing out. And
Okay.
yeah.
Okay.
Does that make sense?
does, yeah.
Okay. So let me know if you're have any problems or any chest pain or any lightheadedness, let me know.
Okay.
Okay, Lacey, you get to go home. Yay.
Yay.
All right. So, do you have any questions for me about what we've talked about so far? Your meds, your heart rate, taking your pulse?
I don't think so. I just need to make sure I take it every day.
Yes. And tell me again, remind me how you're going to take that.
I'm going to take it right here, and I'm going to count for a full minute.
Okay.
And if it's less than 60, I'm not going to take my metoprolol.
Right. And you're going to contact your doctor because they may need to adjust the dose.
Okay.
And then you said you have your blood pressure cuff. If your blood pressure is, if the top number is under 100, call your doctor.
Okay.
So what are some of the side effects of the meds besides lowering your blood pressure and your heart rate? What are some of the things you might experience?
Dizziness, nausea. I know that
Okay,
it's
good.
in here, though.
It is in there, and the thing I want you to remember is, if you have any side effects like that, or your heart rate's under 60, your blood pressure's under 100, call your physician and hold that med, because they may need to adjust the dose, and just remember to write down your blood pressure and your heart rate. And if you have a smartwatch, that'll do it as well. That'll take your pulse for you.
Okay, I do.
So, okay, cool. Yeah, so just when you're getting up, just be careful. The older we get, our equilibrium doesn't quite go as quick as it used to. So when you're getting up, don't just jump up out of bed. Just stand there for a second, sit there for a minute, then stand there for a minute, because we do have you on meds to lower your blood pressure, so that can make you feel dizzy if you jump up quickly.
Okay.
So yeah, take those notes back. And of course, anytime you have chest pain or difficulty breathing, call 911 with chest pain. I also want you to be aware of signs of stroke. So anything, if you have facial droop, your speech gets slurred, you have weakness on one side of your arm, you feel dizzy, call 911, okay?
Okay.
So, do you have any questions for me? Okay, when your ride gets here, let me know and I'll have you sign your discharge papers. Did you get all your belongings?
I did.
You signed your belonging list. We didn't have anything locked up or any of your valuables.
No.
Okay. All right, well, it's been a pleasure taking care of you.
Thank you.
Hope you enjoyed being at Mason General. If you have to be at a hospital, hopefully this was a pleasant stay for you.
It was. Thank you.